There is a national shortage of nurses. Some attribute it to burnout from the pandemic. Another reason, retirement has now arrived for the baby boomer generation.
In tonight's Health Beat 4, KTIV's Claire Bradshaw speaks with managers of one local nursing program about how they're preparing future nurses to fill those openings.
St. Luke's College Unity Point Health prepares students to go into various healthcare jobs, one being nursing. And with a national shortage of nurses affecting Siouxland states, the program at St. Luke's College hopes to add to the next generation of registered nurses.
2 years, someone can get in and achieve that goal of becoming a nurse and get into the field of nursing. And so we really value that, but making sure that they feel well prepared for that first position that they will have in nursing.
The need for nurses will grow by 7% to take care of the aging baby boomer population, according to the U.S. Bureau of Labor Statistics.
We've kind of known this for a while, that many nurses are retiring, and there's a lot of flexibility in nursing.
But another reason making nurses hang up their scrubs, burnout, especially from the pandemic. Something St. Luke's College hopes to prepare nursing students for and help them avoid it early in their career.
We have a lot of clinical experiences for our students. So what that does is it puts them at the bedside with the nurses, and then they can see what the role actually entails. Burnout is definitely something that we discuss, and talking about ways to do self-care and to be protective of that.
Lorraine Cicino-Murphy, the academic dean of St. Luke's College, tips now is the time for anyone interested in a medical career to make the move.
Looking for that next generation of healthcare providers. So it's continuous. It's something that we will always need. We'll always need healthcare.
Reporting in Sioux City, Claire Bradshaw, KTIV News 4.
The Iowa Board of Nursing did a survey to determine if the state had a nursing shortage. 35.7% of those surveyed said the shortage was moderate. 35.9% said great, 19.4% said extreme, and 8.9% said slight. The top three challenges, according to the respondents, were finding qualified candidates, turnover and attrition, and the ability to hire new employees.
The Nebraska Center for Nursing says there are 6 counties in the state with no registered nurses, and 6 counties with only 1 registered nurse. However, none of those are in Siouxland. Their data reports 58% of Nebraska nurses are employed in hospitals. 2% of the state's RNs are unemployed. The center reports a statewide shortage is expected to continue through the year 2025. The projected numbers for 2025 show a shortage of 340 nurses in northeast Nebraska alone.
From 2015 to 2016, about 1,700 registered nurses left South Dakota, according to the State Nursing Board. Last year, more than 2,500 nurses dropped out of the state workforce. 14% of the state's nurses live in southeastern South Dakota. But when it comes to recruiting, the state is at a disadvantage because the median pay is the lowest in the nation. That is according to federal labor data. Another factor is contributing to the shortage. Populated cities are becoming hubs for nurses, leaving rural communities with the difficulty of recruiting.